Hi, my name is Dr. Han. I'm a veterinarian at AMPM Ideal Pet Care. So during this pandemic, I know everybody's going through difficult times. In order to, help them and their pets, we try our best. But like some cases, we have to face the emotional and financial difficulties. Those are something that we have to go through like every single day. Personally, like I had a client recently who lost one of her family members from COVID, and her pet, her dog was also diagnosed as a cancer, metastatic cancer, like a few days later. It was very, sad and like a frustrating time for both of us. Not only that, we see a lot of problems from these situations every single day. So, although we try to help them as much as possible, sometimes I feel like, I'm also going through some, mental fatigue from those stressful situations too.
Working during this pandemic has made it both easier and harder. Harder because our traffic has increased, so we have really long wait times, and that makes clients a little uneasy, but we try to work through it. This is all new to us. We haven't been through a pandemic before, so this is our first one. So we're working through it together with our clients and our staff here. Easier because it's now more one-on-one with our clients and with our patients. So it's more privacy. We can actually speak to the owner separately, not in a lobby in front of everybody. So it makes it nicer.
Ever since pandemic started, it's always been a challenging as a doctor that we're not able to provide the best route of communication to the client. Biggest part of practicing veterinary medicine is all about communication, letting them know what's going on with their pet, and diagnostic results and treatment plan, talking about prognosis will make a dramatic difference. However, ever since pandemic started, we weren't able to have face-to-face interaction with clients, and that becomes very challenging aspect of practicing veterinary medicine. We really look forward to getting over the pandemic so we can certainly go back to how we used to do things, so that we don't have to do things over the phone or emails, and that's something that we really look forward to. We try to do things and we try to ensure that we do our best to provide as best of a quality of veterinary medicine as possible under the circumstances that we always ask our clients' understanding in order to make things happen.
One thing I would like clients to feel is assured that we are doing the best we can to take care of your little ones. We're doing everything to go ahead and give them the best care we can possibly do. We're doing everything that needs to be done. Yes, it's slower. Yes, it takes time, but we are there to go ahead and get everything done, giving all the necessity, being careful, making them feel comfortable. All that takes time. And because it takes time, we're giving everybody the attention that they deserve. And so we just ask that you be patient with us because we're doing the best we can here.
Hi, I'm Dr. Choi. I'm practicing veterinarian in AMPM Ideal Pet Care. First of all, because of difficulty period of time, and then most of the client is having financial difficulty, and as a result of that, the diagnosis that I'm gonna do will be pretty limited. So as a result of that, it's a little bit difficult to figure out what's going on. Of course, regardless how many diagnoses that I'm doing my best to figure out what's going on and then to try to help the patient. But still, if the diagnosis itself is limited, there is some difficulty to figure out what's going on. I hope that they understand that we are doing our best to try to help them and to try to save the life.
I would like to reassure everyone waiting outside that we are helping as best as we possibly can. I'm doing every day. I study animal psychology and behavior, and I know separation is a huge thing with patients and owners. And I just want to reassure that I'm doing everything in my power to make sure that they are stress-free and they're getting the help and the treatment that they deserve and everything that is specific to them. Other than that, I just also want to say that there are no secrets and we genuinely want to help.
I think this pandemic has been a new thing for, everybody. I don't think none of us was ready for what we're experiencing right now. But if we're talking about the veterinary field, there's pros and cons about the pandemic in the veterinary field that I can say that the good thing about it is that now that pet owners are spending more time with their pets at home, they're noticing more stuff that they weren't able to notice on a regular day when the pandemic wasn't happening. We've seen a lot of clients that they're noticing that maybe their pets they have like a limp or they have like a lump that they never noticed, but now that they're spending more time with their pets, now they're noticing more stuff and they're taking their time to bring them to the veterinary clinic. And then I think that's one of the reasons we have seen like an increase in clients coming in with their pets. And I think that's a good thing that's happening. But now you're seeing clients that they want to help their pets, but now they're being affected for the financial restraints that they're experiencing too. Maybe they don't have a job, or maybe their hours have been cut. And then, like I said, there's good things and bad things. But at the end of the day, I think everyone has been affected by what's going on. And here as a veterinary technician, you get to experience a lot of emotions when it comes to their pets. You want to help them, but at the same time, you also have to have an open mind and try to understand the clients and what they're going through as well. And that's what I feel like I'm experiencing on this pandemic. And I feel very lucky that I'm able to do what I do, which is help animals and do the best I can to provide the help they need and the love they need to, and also tell the owners that with what's going on, they're not able to be with their pets inside. And for me to tell them, hey, your pet, it's in good hands, and we're able to help them and tell them that everything's gonna be okay and we do our best. So at the end of the day, we're all going through the same problem, and then this is where I think the human part of us has to work together to make it work, and then happy to help them and make their babies feel better.
I worry about how nervous and scared the animals are. When we're examining the animals, the owners are not present, so they don't get to see what the doctor's looking at. The doctor can't point to them. This is it, this is how bad it is. And the more we go out and interact with the owners, the more likely we are to catch something from going outside and being around people. It's dramatic. They get sad. They want to be there with their pet too, and they can't. We want to be there when they're crying and scared and worried, and be able to give them a hug or a pat on the back and things like that, but we can't get close to them now, so we can't comfort them like that. That's a lot of those things have changed dramatically in the way they used to be because of that. That's why you're out there waiting longer than you would normally be, because we're taking extra steps to make sure that your pet is comfortable with us.
Hi, my name's Adam. I'm one of the technicians that work in the back, mainly in the back, not so much in the front, but you will see me every once in a while. On the topic of COVID, I just wanted to say that the biggest challenge I feel like what's going on is trying to get good communication with the clients and having them understand that we are a walk-in facility. And with that, we are also working with organizations such as ASPCA and also animal control, which could take up a lot of time because you do need to get approval from other areas. Moving on to that, it's just, there's a lot of time in that. We have over 25 cages, and sometimes we exceed our cage limit by putting up the portable cages to get more pets in order to take care of them and make sure they are fine, and in our viewpoint to see that they're stable. So there is a lot of pets that we take care of, and taking care of doesn't just mean giving them their shots. It could run from making sure that they are not too cold or too hot, making sure that they're not laying in any pee or poop, while bringing in pets that are outside that could need to be triaged for emergency, or working with animal control who just brings in some strays and they just got attacked by another dog. It's just, I feel like that's the biggest challenge, trying to have people understand that we are a very busy practice as we are walking. It takes a lot of time to do so, and that's about it. I'm sorry for those of you who have to wait in hot cars and have been waiting for hours, but with the quality care that we want for your pets, it just does take time.
Every single person in here has the best interest of your pet. We like to make sure that the pets are well cared for, treated with respect and love, and that treatments are done properly. Sometimes it's a little hard. There's days where it gets overwhelming, and also days where it's a really good day at work and you're having fun with your coworkers and you're just, saving lives all day.
I'm Officer Mills, and I'm from LA County Animal Care and Control. And I could say a positive thing that's happened with the pandemic, COVID-19, is that we've seen an increase in our adoption rates. And that's really great. That's a positive thing. But my only hope would be that after things start to die down, things start to go back to normal, that people will hold on to these animals, and that when they return back to work, that they still make time for the animals that they adopted, and that they realize that adopting a pet is I don't want to say a lifelong commitment, but it's a long-term commitment. So it shouldn't be something that, you adopt just because, you have time on your hands, you're at home. When you return back to work, things return back to normal. Keep those pets in your care, and that would be my hope, that the pets stay adopted and not return back to the shelter.